Good morning, people at home. Good morning, everybody in here. It's Friday. You made it to the end of the week. Hooray. Today is the day you've all been waiting for. That may not be true for a lot of people, but we're gonna do the dissection today. So I mean, we may as well just get started. I'm gonna go grab the pig. I'm not allowed to leave it in here overnight. It's got to be in the hazardous waste cupboard. So I'm just gonna go grab it. But I've got my setup ready to go here. I'm gonna do everything on video. If you have any questions while this is going on from home, don't be afraid to ask them. I'll try and keep an eye on this chat. Or if you'd like me to show something specific that I haven't shown very well in the dissection, give me a heads up. If you're at home, let me know you're here with a here or a present, just so I can record you on my attendance. Hi, good morning.
Yeah, I just talked to my question about a question because I kept blocking from making a question. So I just did the whole time.
No worries. I'll grab the pig. So you guys just let me know if you're here in the comments, and I'm gonna switch this around so you can kind of. Okay, if I stand over here while I'm dissecting, tilt this up just a touch. Here, and my dissection right here. Okay, that'll work. That'll work. I kind of wish it was oriented a little bit differently. Oh well, we'll make it work. We'll make it work. I'm gonna move the mouse and everything out of the way here, so I definitely don't want to get pig on my laptop. That would be a bad day. So this area right here, it's like, where's the boundaries of this? Right here to here. That's perfect. I'll leave the pig right there. Already mentioned you wanted to do some cutting. Anybody else here interested in cutting the pig? Yeah? Anyone else?
Just how though?
Yeah, I'll tell you where to cut. Absolutely.
Jesus.
Anyone else? Anyone else wants to touch that pig?
Oh.
You don't have to put them on right now.
Oh.
But this is just for when you're cutting. Don't worry.
I don't want to, but I want to see. So, but something was so kind of time. It kept blocking from sending me emails.
So, you know, I shouldn't say, it's so boring. If I shouldn't say that, and be like, oh, look at its top page. So what are you guys going to do for Halloween?
What do you mean? He asked what it means for Halloween. I'm not doing the photo shoot.
Well, for me, I'm going to go on my Xbox and just play Dead by Daylight as Michael Myers all day. Well, not all day, but like at night.
Are you ready for the beginner quiz? Then are you ready for the quiz? Huh? Are you ready for the beginner quiz? Why don't you just laugh like the usual? Are you ready for the beginner quiz? Beginner quiz answer. Are you ready for the beginner quiz answer? You don't know.
No worries.
What's that?
What's the baby one?
They're fetal pigs, so these are unborn, so they've never made it out.
So how did you guys get it?
So we get them usually from the slaughterhouse. So they basically are, if there's a pregnant female pig that goes to the slaughterhouse, they don't have anything to do with fetal pigs that are inside if it's pregnant. So they sell them to a company, puts them in a preservative, and then we buy them from them.
Why don't you let it get another pregnant?
I don't know. That's actually a really good question. You mean, why not let them give birth first before you slaughter the pig?
No,
These are green. It's not that cold yet.
I'm actually not sure what the economics are
or
of
why
that.
don't we just raise another one? That's the big deal.
Why don't you raise another?
Raise another pig.
Well, these pigs are not born yet. These are unborn, right?
No, just let it be born and just raise it. Why would you keep it out?
Right. So good question. Like I don't know what the economics are of that, of whether or not that like costs more money, or potentially like I actually don't know. So, but somehow this is economically feasible for farmers. So
They keep the mother, but they don't let the mother have the baby.
they don't.
They don't let the mother give birth.
The mother is bacon. It goes to the slaughterhouse.
I don't know.
Do you know what I mean?
So the mom and the baby is killed.
That's correct. It's not technically a baby yet. It is unborn. So these pigs were never born. I guess that's too much. So what we're gonna do?
What the heck?
Is we're going to use this as an opportunity to review all three body systems. So we're going to look at the respiratory system of the pig, the digestive system of the pig, and the circulatory system of the pig.
So you're gonna cut all of them?
What's that?
You're gonna cut every one of them separately?
Yeah. So we'll start with the external anatomy. 1 second, we'll look at the mouth. We'll work our way through.
Do we need a Chromebook?
So this is the bottom, this is the top. Okay. Do you need a Chromebook?
Yeah.
No. You just gotta watch. I think they do one to look stuff up when you're watching this one. But I think I'm gonna turn this light off again. Is that easier for you guys to see?
Yeah.
A little bit better. Now I gotta try not to splash anything with pig.
Okay.
They're a little bit wet because they're sitting in a preservative, so fairly juicy. If the smell starts getting a little ripe, we'll crack a window, okay? Just as a heads up. Let me know if it's starting to really bother you. I feel like I'm immune to this smell at this point, but if it's starting to get to you, let me know.
How long do you guys store these for?
What's that?
How long do you store it for?
We usually buy them maybe a year in advance, so they're here for about a year in preservative.
They don't get bad?
They're sitting in a formalin, which is formaldehyde, a little bit of alcohol, and well, it's not, actually it's not technically formaldehyde. It's analogous to formaldehyde. It's like a similar chemical to formaldehyde.
And that keeps them alive?
It doesn't keep them alive, but it keeps the tissues from degrading. So they'll last in formalin like this for I don't know,
It's not gonna
20
make that-
years, a long time.
It's not gonna make that room smell?
What's that, sir?
It's not gonna make that room smell?
It's gonna smell a little bit.
No, the other room you store it in.
Oh, you mean like rot? No. So the formalin prevents rotting, and so you don't end up getting like a really significant smell. Oh, I really don't want to drip this on my chair. Okay, here we go.
Oh my god.
I'm just gonna let it drip here for a second, so I don't want to take too much liquid.
I have my mom, she like preserves them, so she gets like pigs and stuff and like other like animals off of people, and she puts them in jars. And we have like taxidermy at home and stuff.
Interesting, interesting.
Yeah.
Oh, so you probably know a lot about this. I bet the preserve probably keeps them for, I guess, indefinitely, I guess, eh? As long as they're immersed. Yeah. That's kind of cool.
And it's the boy.
Um,
Wait, is it?
Wait, that's the board.
yes, it is. So this little bump at the bottom here. Oh, actually, I'll wait till this is on the screen so people can see it. But this is a boy. So this, right underneath the umbilical cord, this is the umbilical cord, the umbilicus. Right underneath, this little bump right here is what is going to become a penis. And you can see that it has a little hole in the middle, that's the urethra. So this is a boy, yes. And the other way you can tell is if you look at the back, if there's only one hole back there, that's a boy. This is a male.
Wait, what's wrong with its neck?
What's that, sir?
Its neck is like open up.
Yep, its neck is cut.
Blue.
Oh, that's the stuff.
It just, it breaks. It breaks during the, and keep in mind, like these, I mean, they die at the point where their umbilicus is cut, but they're like stuffed in a bucket with, you know, hundreds of these guys. They squished and stuff like that. So they're not like, everything's not in perfect condition. I'm hoping that they're not going to be too badly squished inside, because if they get really, really badly squished, then you can't, see the organs properly and stuff. But usually it's not too bad. Let's seal this up. Stink too much. Oops, a daisy. Oh, the rubber seal came out. Let's try that again. I definitely want this to be sealed properly, otherwise it's gonna stink in the other room. There you go. Good tight seal. And I brought a waste bucket. So we're gonna put it at the end. Okay, so the first thing I'm gonna do here, let's take a look at the external anatomy. Before I close this up, this is the mouth, obviously. Open it up. Now I'm gonna have to do some cutting on the sides here to really open this up so you guys can see down the throat. But if you're a little bit squeamish, this is a little hard to look at. So what we're looking at the back of the throat here is the oropharynx, which is just the back of the oral cavity, and the pharynx is just the back of the throat. And if you look inside, if you remember from the respiratory system, we talked about the epiglottis, right? That little flap that covers up the trachea so that you don't swallow stuff into your trachea. So you can actually see the epiglottis here. Try to pull this open a little further. The epiglottis is actually this flap right here. There we go, you can see it. So that's the epiglottis. So when the pig swallows, this flap is going to flip down and cover up the trachea so that the food goes down to the esophagus. And then when it's breathing, whoop, just flips back up again so that you can breathe. And later on, once I have everything open, I'll poke this probe down both holes so you can see where they go. One of them is going to go in the lungs and the other one's going to go into the stomach. Question?
So yeah, flap. When you're breathing, is it just like loose? There's no muscle holding it down?
It's like cartilaginous. It's like has like a fairly it's not like that soft really. The shape of your throat when you swallow, that muscle movement to actually push food down, also simultaneously that muscle movement pulls the flap down. And when you relax your throat when you're done swallowing, it naturally swings back up. But it's not super floppy. Like this is a fetal pig, so like the stuff doesn't have like the solid consistency of like a complete unit, you know, like this stuff's not done developing yet, but it's quite hard, so it doesn't like flop around or anything. Okay, so I'm gonna tie this guy down so we can see the inside a little bit better. I'll try and keep this oriented this way. It's a little weird because I'm not looking at it in the same orientation that you guys are at home, so I'll tie it down like this. Is it snowing? Oh, I don't have the blinds open.
A little bit.
Is it?
Like, it's the grounds are not like full snow or anything. It's like literally just like snow.
Well, it's that time, I guess. So I'm just tying these limbs down so that it's a little bit easier to see once we get into the oops, a daisy, when it gets into the cavity here. That's going to happen quite a bit, so sorry about that, if that's making you a little bit squeamish. Things are definitely going to break here, guys. One of the really cool things, and the reason why we do a fetal pig dissection, is because the organs in this thing are pretty much identical to yours. There's almost no physiological difference at all. So it's a really, really good analogous sample to use for a human. I'm sure for some of the people at home, they're glad they don't have to be here in person. Some people love this, and some people are like, oh no, this is the worst thing. So in a second, Brody, I'm going to get you to come down here and make the first little tentative cuts, okay? Oh, I thought you wanted to make the cuts.
Yeah, but not the first cut.
Not the first cut. Okay,
So
all
I
right.
don't want to cut too deep and like destroy all the forward.
Fair enough. Then I'll get you in a minute then. No problem. Sorry. It's all the tissues are really fragile, right? Oops, a daisy. They've been sitting in preservative, so they don't have the same kind of like tensile strength that they normally would have. Straight a little too long here. Used to be so comfortable working with gloves on, but it's been a little while. Awkward. Oops. Skin. Okay, perfect. Okay, so I'm gonna make some cuts here. We're gonna cut right down the center of the thoracic and the abdominal cavity. Abdominal cavity is down here, and then I'm gonna cut this way and this way, and we're really gonna open up the abdominal cavity in here, okay? So I'm gonna start with the abdominal cavity, which is right below your ribs. So if you feel where your ribs are, right at the bottom of your ribs is, that's where your muscle for the breathing, diaphragm is, okay? And it creates a seal. There's actually like two separate cavities. There's a seal between your thoracic cavity, which is where your ribs are, and your abdominal cavity below. So they're isolated inside. So I'm gonna try here to just cut below the ribs, because I only want to show you guys just the abdominal cavity for now, and we'll get into the thoracic cavity after.
Why is it called a cavity?
Well, because it's like a cava is Latin for like cave or like opening, or like open area. So it's a cavity because it's just like a sealed chamber basically inside your body. So your organs are attached to the outsides of it, but they're like sitting inside of a chamber in your abdominal cavity or your thoracic cavity. I don't want to cut too deep. Oh, there's probably a bunch of goo in there. So this is just from the preservative. So there's
That's not the blue blood.
no, it's not blood. So the blue and the red stuff that you see, they actually that might be part of what this cut is up at the top, but they take a preservative, a blue rubberizer, and they pump that into the veins, and they have a red rubber basically that they pump into the arteries. And the idea is to make it easier to identify them when you're doing your dissection. You can buy ones that don't have that in it too, but that's what the red and blue stuff is. So it's not blood. There we go. So I don't want to damage anything underneath. I may have to take this over to the sink and just give this a little rinse. Because I think otherwise we're just going to be looking at a bunch of goo in here. Stuff does have a habit of getting damaged when they get squished and stuff during transport and when they're being packed. So I think I'm going to have to probably give this a rinse. I'll open it up first and then I'm going to rinse it. So this is abdominal cavity down here that I'm opening up. If you look at the actual layers of the front here, this is just like you. You've got that skin layer on the very outside, and then underneath there's a layer of fat and fascia underneath. And just below that, there's some layers of muscle and inner fascia, which is in here. Those are like the abs, because this pig's abs, abdominal muscles. Pigs don't do a lot of sit-ups, so they don't have the most well-developed abs in the world. I dare say most humans don't either. So, Brody, then I'm going to probably get you in here to remove some of the organs after we open this up, okay? You all right with that? We'll identify some of them and then we'll remove them together. Be extra careful with this scalpel. It's quite sharp. It is designed to cut flesh, so I'm going to cut the umbilicus here. It's kind of in the way, but it is holding the abdominal cavity like down right here. You'll notice that it is connected to like the main artery here for the pig, and the main vein would be the inferior vena cava for the, well, it's an umbilical vein and umbilical artery, but they're connected. And that just makes sense, right? Because all of its blood supply, it's basically on a heart and lung machine right now, right, from the mother. It does have a heart, and the heart is doing some circulation, but it's also getting blood from the placenta, and which is all the oxygen is coming from the placenta, right? So no breathing going on in the womb. Maybe I'll cut it up here, actually. You can see which one is the vein there. It's got some blue plastic inside. All right, I'm definitely going to give this thing a rinse because this is it's a little messy. So I'll be right back, guys. This will take 2 seconds. I'm just going to use the sink at the back of the room. This will get a little better. We don't lose any pig. Might actually help with the smell a bit too. Okay. Oh, perfect. Like all the organs are there. Okay, so first of all, let's see if we can identify some of these things. I have an update. Liver. You got it. So this big bulky guy right here, it's the biggest organ in your abdominal cavity is your liver. With regards to the digestive system, anybody remember what the liver does?
Basically filters out the alcohol.
So that's one of its metabolic functions. It really, all of the nutrients that are coming into your intestines, they pretty much all pass through the liver first before they're distributed to the rest of your body. So it is going to process almost everything that you take in from a nutrient perspective. But in terms of actual digestion, though, anybody remember what its role is in the digestive system? That's the only one that we talked about together.
Is it a filter?
So it does act to modify all of the different nutrients that you take in. Brody mentioned alcohol. That's one of the things it does. It produces alcohol dehydrogenase, which breaks down alcohol. So that's one of the things that the liver does. But with regards to digestion, its main function is that it makes bile. So the liver makes bile, and bile is used to help break down fat. So it puts fat into little smaller packages, micelles, that allow it to be digested a lot easier. So you don't get a big clumps of fat going through your digestive system, which can't be digested. So that's its main function. And it stores that bile that it produces in a little tiny sac on top. Anybody remember what that sac is? You can actually see it. It's right here. It's this little sac underneath the liver. It's this little guy right here. The sac has a little tube that goes right into the small intestine. So that's your gallbladder.
Oh.
So the gallbladder stores bile, and it's going to put that into the small intestine. Before you guys write the quiz today, you may want to go back over the stuff from the digestive system real quick, okay? Because there's a bunch of digestive system stuff on there, and I feel like people have lost their familiarity. I realized it was several weeks ago, but it's kind of hard in this environment. But anyway, there's the liver, there's the gallbladder, and if you look at it, it's kind of hard to see inside here, but you can actually see that this gallbladder is attached with a little tube that goes down right into the small intestine, which is back there, okay, which we'll get to in a second. So I'm actually going to remove the liver, or Brody, if you want to come over, you can cut it out if you want.
Oh yeah. Let's do this.
Oh my god.
He's ready. He's ready to start cutting stuff out of this pig. Right on. I'm gonna lay down some paper towels here so we can put some of the organs down on it. Do me a favor and try not to get this stuff on my laptop, okay? I really don't want any pig on my laptop.
Should I put my sleeves up?
Pig smell.
What's that?
Should I like put my sleeves up?
It wouldn't be a bad idea. Wouldn't be a bad idea. I'd roll them up to your elbows, and you know what? If I could do it with mine, I would too. But I think I'm good here. Okay, so at the back of the liver here, there's an attachment. It's a major artery and vein where it's attached, hepatic artery and vein. Okay, and so I'm just going to get you to trim that stuff off. But try not to cut into the other organs. Just go behind the liver and see if you can cut just the liver. It's these three lobes here of the liver.
Yep.
I would use the scissors.
Oh, so
Scalpel works too, but it's actually much harder to cut it properly. I highly recommend scissors.
Okay. So just skim it.
Skim it if you can across the back and just see if you can snip it out. I'm going to get you to remove the organs for the respiratory system if that's okay. You alright with that?
Yeah.
How deep does this go?
And you can take your time. Don't worry about it. I won't rush you through. Okay.
It's hard to find, isn't it?
Keep in mind as you're watching this that this is what you look like inside. The layout, the relative sizes of the organs, what the organs look like this is what a human looks like. It is really exactly the same as this, which is kind of cool.
Can you check? I think I did cut it, but I'm not really sure.
Sure, yep, you got it. So the last part here is you just got to cut through. Well, actually, maybe you got it. You might have got the whole thing.
Oh, that sound.
That's just rubber. I'm literally just tearing the rubber inside of the blood vessels. Yeah, it's okay. You actually did cut it out. Okay, so there's the liver right there again. It does have some blue plastic on it there, which kind of takes away from it a little bit, but on it
Huge.
you can see That's the gallbladder right there, that green guy. And
Okay.
Why gallbladder is so small?
it's the function of the gallbladder really is just to hold bile. It's just like a bile storage sac, and you don't need that much bile.
Really?
Yeah, because I mean, how much fat can you consume in one sitting? Actually, it's not a challenge, but I guess it could be a lot. But you don't usually generally need more bile than what you can store in your gallbladder. So it doesn't really need to be any bigger than that.
But what happens to the excess one then? It's like,
What happens to
like just they have too much bile, then what happens?
too much bile?
Yeah, and like the sacs can't hold it. Then what happens?
Well, it is attached to the small intestine, and so it will just continuously just kind of leak into the small intestine.
With the-
Too much bile is not usually too problematic. If anything, it'll just cause you to have lower cholesterol because bile is made of cholesterol. So as you lose bile, you're actually getting rid of cholesterol, excess cholesterol usually. I've never heard of anybody that produces too much bile before. I suppose it's possible.
But you have like a surgery to get it out.
So that's usually if you get gallstones. So sometimes the bile, it's made of bile salts that are dissolved in water. And if those bile salts, where's the gallbladder on there? If those bile salts come out of solution and start forming crystals inside of your gallbladder, they can block this pipe, this little tube, and then you got a problem. So then it keeps adding bile to the gallbladder, but it can't escape. And so your gallbladder will get all inflamed and like full. And you could potentially need to have it removed surgically. Sometimes you can pass the stones, basically just force them through the tube, but they're sharp and sometimes they're fairly large and it's very painful.
You know
My
how-
mom had the surgery to get their gallbladder out.
Okay, so she's already experienced this before.
Yeah.
My grandma had the same thing. So it's quite common to have it removed. If you've got really serious stones in there, you probably have to get it taken out.
Yeah.
And you can survive with no bile. You don't have to have bile, but it just reduces your capacity to digest fat. That's basically what it does.
So is that gonna affect the person?
It does make it more difficult to eat fatty foods because they don't get broken down. It means some of the fat is actually going to go right through your digestive system, and that changes the consistency of your waste. It makes it more fatty and less solid. So that's problematic sometimes. But it doesn't. It's not like fatal or anything. You can totally live with obviously with not having a gallbladder. So it just does reduce your ability to digest fat. That's pretty much what it does, and changes the consistency of your waste. Okay, so looking inside here.
Do you mind helping?
Yeah, I'm gonna get you cut out all these.
Okay.
Yeah, just give me 1 sec. I'll talk about them and then we're gonna remove them one at a time. So we got a sac right down here. If you look up near the top of the sac, right up here, you'll see a tube. So that tube actually goes all the way up to the this is the esophagus right here. So if I were to poke down, you can't really see this on camera here. But if I were to, I'm not gonna do this one. But if I were to poke from the mouth here into the esophagus and go down, it would actually be a continuous tube that goes all the way down here into the stomach. So when you swallow food, that's where it's going. It's going into this sac right here, and it is pretty sacky.
What's the
If you poke it, oh, I've got the pancreas here too. That's the pancreas, by the way, in case you're wondering what that little flap is on the side. So that's the pancreas. That makes a whole bunch of digestive enzymes. It also makes insulin, which if you don't have type 1 diabetes, it's currently doing for you right now. So this is the pancreas underneath here, but this right here is the stomach. And you can look at it, when I poke it, you can tell it is a sac. Like there's some stuff in there. Now this is a fetal pig, so it's never eaten food before. So the only thing that's inside here is preservative and amniotic fluid. So it doesn't actually have food inside of it because it's never eaten a meal. But there is also things like dead skin cells and things like that, stuff that's floating around inside the amniotic fluid. So normally when a baby is born, this pig would have made it to maturity, to being born. When the first couple times that a baby poops, I don't know if people know this, it's just like a black poop. It's called meconium. And the meconium is basically just like dead cells and things like that that are left over in the digestive system after it's done being produced.
Isn't it like really sticky?
It's sticky, yeah. It's this gross black sticky poo.
Yeah.
And so that's the first poo that a baby has, and it's basically what's left over in here after you make all of the digestive organs and stuff like that. There's like dead cells that are left over, and then you have to remove those.
Even with like humans?
Yeah, humans do that too. Yep, absolutely. If you ever have a baby, you'll find out. For the first poop's gross. I mean, they're all gross, really, but the first one's black, and I think a lot of new parents, when they see that their baby has this like sticky black poo, they like panic and they're like, "Ah, there's something wrong with my baby. It has a weird sticky black poo." It's like, oh, no, that's normal. Every baby has that. Okay, so what I'm going to get you to do. So right at the bottom here of the stomach, you'll notice there is a little loop here. This is the beginning of the small intestine. Do you guys remember what that first loop of the small intestine is called? This is actually where the most digestion is done. Right in the very first loop. Do you remember?
I do know, just can't remember what it is.
So the first loop is called the duodenum or duodenum. Okay, so this is the duodenum here right at the beginning. And what I'm going to get you to do is just cut off right before the duodenum. Okay, so we're just going to remove the stomach. So you're going to cut right here, cut at the esophagus, which is right here where it's attached at the top. And there might be a little bit of fascia and stuff, but try not to cut open the pancreas or any of the other digestive organs. So this is a little challenge for you, okay?
Okay.
I'll leave it open for you there. And then you can set it down over here. I'm going to cut open the stomach too so you guys can see what the inside looks like.
Oh,
It's
that's
not
weird.
perfectly formed.
That feels weird.
Yeah. Yeah, it's full of liquid. It sure does feel weird.
It feels so weird.
It definitely feels weird.
Oh yeah, how much questions?
Okay, now where's the esophagus?
31, I think.
Oh, the
And it's stuff all throughout the notes from digestive, respiratory, and circulatory system.
and then
How are you doing there, Bruce?
There's no time limit, and it's open book. So feel free to look right at your notes while you're doing it.
Pretty
Take your
good.
time.
For the presentation, could I do robotics?
Squishy?
Robotic surgery?
Yeah.
Absolutely. As a treatment methodology?
I'm not sure.
Because you're picking something that's used to diagnose illnesses of the digestive, respiratory, circulatory system, or
Oh,
to treat them.
Okay.
So absolutely, you should as a treatment technology, just robotic surgery in general. As long as you can find ways to apply that to the respiratory, digestive, or circulatory system, you're good.
sorry, you want me
I think you probably can.
to take the pancreas off or just leave it with the stomach?
Just leave the pancreas there,
Oh.
if you can. You want to cut around it. So
I think it.
it is attached to the bottom of the stomach loosely with a little bit of fascia. You can just snip it off. Snip the fascia that's holding it to the stomach.
Okay.
I mean, do your best. It is difficult to get it out of there. I'm giving you a bit of a challenge. I realize that.
Oh, I don't want to cut it. I don't want to cut it. Oh, there you go.
There you go. That's that exactly. You got it.
What else?
And then just across the back of the stomach, there is a whole bunch of arteries and veins that are attaching the stomach to the digestive system. So you do absorb a little bit of stuff through your stomach. Not a ton,
How am I
but
supposed
a
to?
little bit of nutrient absorption actually just goes through the walls of your stomach into your digestive system. Water, especially,
can I
be
cut it?
absorbed through the stomach.
Can I cut it this way?
What's that, sir?
Can I cut it this way?
Yeah, absolutely. Anything across the back of the stomach? Yeah, for sure you can.
Okay.
That's where the arteries and stuff are coming into the stomach. from the
This is my
back.
first time ever cutting anything, so
No worries. You're doing a great job. Don't worry about it. We're not in a hurry here. We got lots of time.
Okay.
Do you only do on pigs or you do on animals?
In grade 10, you guys did a frog.
No.
Oh, you didn't?
no.
Oh,
Never.
normally do frogs.
We
in
did
grade 10.
like type and
Yeah, we did notes.
type and quizzes and
Well, all grade 10.
So it was not.
we never do labs.
Oh, that's
The
too bad.
teacher said grade 10s don't do labs.
Oh.
Yeah, so it was.
You know, Mr. Chapter.
Interesting. This course, by the way, has a ton of labs. We didn't do a lot of them, unfortunately, just due to this
We
weirdness.
never did frog.
But I mean, ideally, we were going to do 2 labs a week. That's normally this course has a lot of labs. That's kind of the purpose of biology week. This hasn't been the funnest semester to teach biology, to be perfectly honest with you.
Oh my god, let's go.
Everything that we did in class, I want you to look and see that in real life. Right?
Oh,
Here are some bacteria.
Some stuff
Look at
came
some
out.
bacteria. What's that?
I think some stuff came out digestive.
that
That looks fine.
that black stuff.
That's okay.
Is that dead cells?
It is. Yep.
Okay.
Yes, it is. So at the back there, those are just the arteries.
Oh, I'm cutting into the stomach.
That's okay. We're gonna open it up anyway. Don't worry about it, bro. You're doing totally fine. The nice thing about a dissection is that we do not have to put this pig back together again at the end. This is not surgery.
Surgery.
Okay.
When I was a grad student, I used to do
Oh my
surgery
God.
because we did things like added probes to rats and things like that to monitor their temperature or their blood sugar and stuff like that. And that's a lot different than this because if you make a mistake, that poor rat will die.
Oh,
So you have to be very careful. It's that's a totally different thing.
Or would you like
Yes.
the stomach?
It shows like some of the things that robotic surgery like treats and stuff.
Cool.
So
If you don't mind, I can spend a lot more time going over this once we're done this. But first thing on there, coronary bypass. Boom, that's circulatory system, right? So
Okay.
there's at least one right there. I bet you there's way more that are respiratory, circulatory, or digestive. But you got at least one.
Yeah, look at the stuff inside.
Yeah.
Cool. So that's meconium, what you're looking at right there, which is basically just dead cells. So I open that up there. It's early in the digestive system, so it's not totally digested dead cells. It just looks like a clump of goo. But by the time this makes it through the whole system, small intestine, large intestine, and then becomes the first little poop of this baby guy, then it's pretty black at the end. All right, so if you, let's see if we can actually see the structures inside here. Snip this open. If you want to hang out there, but I'm going to get you to remove the intestines in a second as well.
Yes. Do you want to do the intestine?
It's up to you. You can jump in here too if you want. I was going to get you to take out the lungs and the heart, but it's whatever you prefer. It doesn't really matter to me. So if you look on the inside, oh, this is a little bit tough to see. Is it going to focus on it? Maybe not.
Maybe if you tap on this.
Oh, that's a good.
Oh, there we go. There we go. I just needed to change the focus. So you can see this a little bit, but there's these little folds that are on the inside of the stomach. So those folds are where the acid is produced in your stomach and the mucus on the inside of your stomach. So the mucus is protecting your stomach from the acid so you don't digest yourself. And they are also the little folds where the acid is made. At the top of the stomach and at the bottom, you can see this little guy right here. It looks like a little anus.
Oh, is that the muscle that closes?
That's
Or
right.
is that the valve?
That's right. It's a valve. Yeah. Well, yeah. It is a muscle. It's this is the pyloric sphincter. So this is at the top of the stomach, and there's another one at the bottom. So this one is preventing stomach acid from going back up into your esophagus. And there's another one at the bottom that prevents food from moving on from the stomach before it's actually done digesting. So it closes up to prevent undigested food to continue on. You want to stop it and let it digest a bit in the stomach before you move on. Okay, let's take a look. Oh, gross. Take that one too. Let's keep moving here. So that was attached to the small intestine, which is right here. I can see the open loop. I'll stick my probe into it right here. So this is the small intestine. I'm going to cut the back of this out only because it's a real pain to cut out.
Yeah.
But I'm going to get you to kind of pull it apart in a second. Yeah, so most of the loops that you see in here of intestine is mostly small intestine. So the majority of the length is small intestine, and then there's a little bit of large at the end. I'm going to snip it off the back. So the other thing you might notice is that there is a whole bunch of blood supply. It's a little hard to see here, but there's a bunch of arteries and veins that are attached to the back right here that I'm snipping. And that's because all of the nutrients from your food need to go into the blood, right? So there's a whole bunch of blood supply that goes to your intestines.
What's the blue dye again?
The blue stuff?
Yeah.
It's plastic, but it was injected into the veins, but the veins are not a perfectly sealed system anymore because the pig is not alive. So it kind of pops out at various places inside of the pig. It's not perfect. I'm just going to cut this off the back. Actually, I probably could let you do this.
So how long is this?
Like
the baby stuff? Like baby small intestine?
Like 40 centimeters?
40 centimeters.
Really?
Yep. So if you unwind this whole thing, it's a little less than half a meter long.
Okay.
So it's pretty long. You can once you unwind the whole thing. I won't get you to do it because you have to cut a ton fascia in here in order to unwind it all. Fascia is just like connective tissue,
Yeah.
just holding stuff together inside. But if you look in the middle of this is what I wanted to show everybody. You can see that the intestines are attached with all of these, come on, refocus for me. There we go. With all these tiny little blood vessels. Can you guys see that little network of blood vessels? So that goes all around all the different parts of the small intestine, and that's where the nutrients are going to go. So they're going to get absorbed and then go into all those blood vessels that are in the small intestine. Here, the pancreas, this is the pancreas right here, which is still attached. And you can see that it is also attached with a little tube here. This thing's really having trouble focusing here. There we go. Is that good? Try again. There. This little tube goes from the pancreas right into the small intestine, and that is where you're going to get injection of all kinds of digestive enzymes coming from the pancreas. So to digest sugars and to digest fat and digest, all the gastric juices that are used to digest stuff that isn't coming from the stomach. So there's one main enzyme in the stomach, pepsin, for breaking down protein, but almost all the other digestive enzymes are coming from the pancreas. So it has a lot of activity for digestion. And you can also see this weird knobby thing attached on the back here. This isn't actually attached to this to the small intestine. Oh, come on, get in focus for me. This thing's really struggling with focus. There we go. This little knobbly thing right here, this is the spleen. So the spleen is being used to filter out blood cells. It's removing old red blood cells and stuff like that. That's this guy right here. So it's attached just to the circulatory system
So smaller.
back there. Yeah, it's just a little guy. I mean, this is a fetal pig, so it's not going to be giant, but okay. So the last thing I want to show you from this here is the large intestine. And then this isn't part of the digestive system, but I am going to get Brody to cut out the kidneys so you can see them as well. So, where's my large intestine? So all this stuff that I'm holding here is small intestine, small intestine, small intestine, small intestine. And there, this at the, no, that's small. Okay, hold on. Where is it here? Okay, I'm going to kind of cut this apart a bit to make it easier to see. Yes?
Why does it have more small than large?
Well, do you remember what the function of the large intestine is?
No.
So the function of the large intestine is water reabsorption.
So it just absorbs all the water out and comes up to all the nutrients to make the food.
Exactly. So it doesn't come out as water, basically. So you don't really need that much length of intestine to reabsorb the water. It's actually fairly short length. But the small intestine is there to absorb nutrients. And so you do need a lot of length to make sure that you get every bit of sugar, every bit of protein, every bit of fat out of your food.
Does your large intestine get bigger?
Oh, these both get bigger. Absolutely. Yeah, their size will increase significantly. This is a fetus, right? It's a fetal pig. So like everything's tiny. It's going to get much larger and all these organs are going to get bigger. It's crazy, like just the other day, like we're getting another baby close. We're about to have another baby. And we're looking at the clothes for my son. He's 5 now. And just to like see the size that he was when he was born, it was just like a little pea, just like a little tiny guy. And it's so crazy to think in 5 years that he got that big. Like his organs are like 50 times the size they were like 5 years ago. That's so crazy. Like he's a giant compared to his previous self. So I just think that that's crazy that the humans just have this. I mean, it's all animals do that, but where is the large intestine? It's actually driving me crazy. Okay, this is the beginning of the small intestine. I'm going to pull it apart and kind of follow it along here and try and find it. Okay, so oops, I just broke it. Okay, so this is all small. Aha! So one dead giveaway for the large intestine. There it is right there. Is this little tail here. A road to nowhere. An offshoot of the large intestine that doesn't go anywhere. Anyone know what that is?
Ooh,
Starts with a U.
Starts with an A, and you may have had it removed.
that's the one you can take.
That's your appendix. Yeah. So this is the appendix right here of this guy, and it's right at the very beginning of the large intestine. So this is where small goes into large, and so this loop right here on the outside, this thing right here is the large intestine. It's not very long,
Because it's a pig.
although it is coiled up a little bit more than it will be when the pig reaches maturity. But this thing right here is the large intestine. Now there's not a huge difference in size between the large and small intestine in a fetal pig. But when they grow up a bit, it's more noticeably different. So the large intestine is quite a bit larger once it reaches maturity. But at this point, this is the large intestine right here.
Why is it folded up? It just fits better.
Fits better in the abdominal cavity, and it's still being developed. It's not fully developed. So this pig is probably a month from maturity, from being born. So it's not. It's close, but there's still quite a bit of development that needs to occur here before this pig is born. So it's not ready to go. All right, so there's the intestines right there with the pancreas attached. And then now what I'm going to get you to do. So back here, this is not part of the digestive system. This is part of the waste management system of the pig. These are the kidneys, and I'm going to get you to take them in a second so we can look at them closer. But these, there's a big artery and vein that's attached to them here. And these are blood filters. So you're going to pump your blood through these. You're pumping your blood through these right now. And it is removing all the waste products and sending them down here. It's just out of your view into the bladder. Okay, so this is the waste management system for the pig. All right, I'll let you cut those out. There's fascia that goes all the way around. So this one you could use a scalpel for. Just be careful, it's quite sharp. And you're just going to cut the fascia. And then there's a big artery and vein that go into the kidneys from each side. And you just want to snip that off and pull the kidney out.
Okay.
Make sure you're cutting away from yourself with the scalpel. You don't want to cut toward the finger, just in case it slips and then you may end up
just use scissors.
having fewer fingers. Sure, or scissors. Scissors are fine too. Absolutely.
This is fun, isn't it?
What's that?
I said this is fun, isn't it?
I like it. I think this is cool.
Can I move this out of the way?
Yeah, so that is the very end of the large intestine. So it's just going from large intestine into rectum, right there.
Oh. Oh, yep, there's the stuff.
Yeah, meconium, it's in there. Sorry, you're trying hard not to look at this. I understand. It's not to everybody's taste. We have people in class that pass out and stuff while we do this, so I totally get it. It's not for everybody. Not everybody wants to see
People
this.
just pass out just by looking at this.
What's that, sir?
I say I know some people who pass out doing surgery.
Yeah, it makes people feel sick. That's fine.
And then people just feel sick.
I get it. I wouldn't fault anybody like this. I totally get this stuff for everybody.
So, can't find the two valves that connect the.
You got to go deeper.
Deeper.
Yeah, so you're going to need to cut basically straight down from the top there. Yeah, keep going. You can push a little bit. You're not going to go through anything important if you go down.
Okay.
Right behind the kidneys is the spine.
Okay. Is that deep enough?
If you've gone through the little artery and vein there, then yes.
Oh,
And if not, no.
Whoops.
Keep going.
How come you can only survive with one kidney?
Well, you have two.
I know, but I mean, if you got one done out and give it to someone else, how can you survive with one?
You don't need 100% of the capacity of your kidney.
Oh.
So it's able to filter more blood than you technically need to filter to stay alive. It does reduce your capacity for filtering. So yes, I mean, if you give away a kidney or you lose one for whatever reason, you are more susceptible to damaging the remaining kidney from pretty much anything that would potentially damage your kidneys because you just have less capacity to process things. So it's not risk-free when you donate a kidney, but under normal circumstances, it probably isn't going to have any effect on the donor. But if you consume excessive alcohol or anything that would cause you to potentially have a problem with your kidneys, you're much more vulnerable to damaging your remaining kidney.
Yes, I just did a transplant of a kidney.
Awesome. That's exactly what you needed to do. So there it is right there. So there it is. I'm going to cut this open really quick. You can see right on the end there, the tube, that's where the blood goes in and out of the kidney. And I'm going to cut this open just so you can see what the inside of the kidney looks like. Thank you.
No problem.
You can actually, if you want, you can wash up.
Okay.
I got nothing else to remove from the abdominal cavity, so you're good.
Do I just throw it in the garbage?
Yep, goes in the garbage, yep. If for some reason you guys ever decide to take 3U bio and then do 4U bio, you do a mature kidney dissection where you actually dissect a adult pig's kidney, and then you look at all these structures in a lot more detail. But if you open them up, what there is here is
Is that a vein?
it is an artery that's running in the center and a vein to collect the blood. It's a little hard to see here. Wow, I wish this wasn't in such poor focus. There are little cavities inside of the kidneys. But what you're seeing here, where's my probe? The blood comes into the kidney up here, and then it goes in and out of these little loops that go into the outside of the kidney. So those little loops are essentially filters. So the blood goes into a loop, and then as it's going through the loop, the bad stuff that you don't want goes out of the blood and into what is eventually going to become your urine. And then the stuff that you want to remain continues on up back into the vein and then back into your blood supply again.
Mhm.
So essentially, as long as this thing is working, it's only removing waste and it's leaving all of the stuff that you need in your kidneys, assuming that it's working properly. Question?
Yeah, can I use paper towels? Oh, dry.
Absolutely. Yeah, go grab some. I was very careful not to get any goo on them. So, okay, let's keep going. By the way, the kidneys, not part of the digestive system, but I just wanted to show you because they're there. So, let's keep going. I'm going to open up the thoracic cavity now. So we're going to do the top part and we're going to look at the respiratory system. That's the bulk of the digestive system, anyway, the lower part. But we got to look at respiratory and a little circulatory. So we're going to look at the heart as well. I've kind of been mentioning some of the arteries and veins as we've been going, which is all part of the circulatory system, but you'll be able to see a lot of stuff when we take a look at the heart. Okay, so I'm going to open up the thoracic cavity up here. So this is a separate cavity inside the body. You'll notice at the top of the abdominal cavity, it's like sealed. Look at that. So what you're actually seeing there, when I'm tapping my finger on, is the diaphragm. That's a muscle. Okay? So when that muscle contracts, it actually pulls the lungs open and allows you to breathe in. And then when you relax this muscle, that's when you're going to exhale. Okay? Air is going to go out.
We're going to be looking at the respiratory or the circulatory?
A little bit of both. So the lungs and heart are both up there
Yeah.
in the thoracic cavity. So we're a little bit of both.
All my hands smell weird.
Did you wash them?
Yeah.
What do you mean they smell weird?
Smell like soap.
Oh.
Soap smells weird.
Soap's fine. When people say weird, I don't assume soap.
Oh.
So I got to cut through the ribs here, so they're a little bit tough.
Just jam it.
I'm gonna use the scissors to cut through this a little bit easier.
But is it bone?
Yep, it's bone.
So how can you cut the bone?
Keep in mind, it is a fetal pig, so the bone is quite soft at this point. It's not. If this was an adult pig and I had to cut through, I might need a little saw to cut through it. But for a fetal pig, yeah, we could do it.
Oh my gosh.
There we go. So just cut through the ribs in the middle here, and now I'm just going to go off to the side. I cut through stuff up in the shoulder.
Was in grade 12 you do another pig?
What's that, sorry?
In grade 12 you do another pig?
In grade 12, you do a brain, a sheep brain, because you do nervous system in grade 12. If you take grade 4U biology, and you also do a kidney, like a full-size kidney, because you spend a lot more time talking about how that filtering mechanism works.
Ooh, heart.
What's that, sir?
You said a brain of sheep?
It's a sheep brain. Yep.
How about the kidney?
I think it's a pig kidney. I sometimes I get them from the slaughterhouse, and they're definitely from a pig when I get them, because all the parts that I get are from pigs. But I'm just gonna cut this up a little more here. So what I'm cutting mostly here is muscle little bit of fascia. You can actually see the top of the humerus here. Got some blood vessels. This is the carotid artery and the carotid vein right here.
Oh, the blue one?
Yeah, the blue one is the vein. The artery is right beside it, but it doesn't have any color in it. It's just white. And I'm just going to cut some of the fascia that's holding everything to the front of the chest here. You can already see this, like this structure right here. What do you think that is? That's the heart. Yeah, exactly. I don't want to damage the lungs too much. So they're sitting just underneath this, underneath the ribs here, and I don't want to. I'm going to try and cut the back of the ribs to try and get this stuff out of the way so you can see it a little bit better. See that there is there's like this membrane that goes around the lungs. That's the pleural membrane. So there's a little bit of sort of a liquid in there, and that helps lubricate the lungs because they're going to rub up against the inside of that cavity all the time, and you don't want them to have too much friction or they're going to cause damage. So you can get pleuritis, which is when you get inflammation in that membrane, and then it's actually quite painful to breathe. You get pleuritis. So I'm cutting the pleural cavity right now. That's this thing, this little membrane that I'm cutting. It goes around the lungs. This is actually a really good, normally when I cut open the pig, you cannot see the diaphragm that well. But in this pig, it has got one heck of a good diaphragm. So you can really see the diaphragm right here. This is the diaphragm tissue. And you'll notice, so that's what separates the abdominal cavity from the thoracic cavity. And it perfectly conforms to the bottom of the lungs. So when you pull on this, by contracting it, that's going to pull the lungs open, right? Because there's like a negative pressure in between there. So it's basically going to stick to it and pull open the lungs.
The two things around the heart, that's the lungs, right?
What's that, sir?
The two things around the heart?
That's right. That's right. So right in the middle here, we've got the heart. That's this guy. And then we've got the lungs that are right next to it. And that's why the right side of the heart doesn't really have to be nearly as powerful as the left side of the heart, because it's only pumping blood here to the lungs, right? There's a lot of blood vessels in the lungs, kilometers of blood vessels. So yeah, you do have to put quite a bit of pressure in there to get it to go through all the tiny little vessels, but it's not the same as pumping it to the entire body. So did you want to remove these lungs? So I'm going to hold them for you, and then I'll get you to snip, snip, snip. Or maybe I'll get you to do the heart first. What's easiest? Maybe the heart's easier. Yeah, it might be easier to do the heart. I'll hold the heart out of the way, and I'm going to get you to cut the superior and inferior vena cava at the back. You can actually see them. I don't know how well this is showing up on camera. But right back here is the inferior vena cava, right here. And then the superior vena cava would be above it, underneath this. Pull that out of the way. Yeah, superior vena cava is this blue guy right here going to the top of the heart. So superior, inferior vena cava, and then actually just beside those things, on the other side here, is the aorta. It's kind of back behind the heart a little bit. It's hard to see, but maybe we'll get a piece of it when we get the heart out. So I'm gonna hold the heart up like this, and I'm gonna get you to use the scissors and just snip, snip, snip along the back of the heart.
Wait, where?
Get that out of there. Do you see the blood vessels holding the heart in there?
This thing?
Yep. You're gonna snip, snip, snip that out. Don't cut my fingers.
Oh, there's a lot of veins in there.
Yeah, it's okay. I'm gonna hold the heart up a little bit,
No.
and you need to
Underneath
kind of
it?
cut in
Underneath?
here. Yeah, just don't cut my fingers off.
Oh, so I'm cutting the heart out.
Yeah, that's exactly what we're doing. Cutting the heart out. Perfect. Perfect. You got it. Awesome. Don't go too far, okay? I'm gonna get you to remove the lungs in a second. All right, so there's our heart.
Oh, wow.
Just gonna pull some fascia off here. There it is. And so this is really just like the heart that we dissected. So I'm not gonna go through and actually dissect this heart because we already did a much bigger version of this. But there you can see it. You've got your right atrium, right? Right ventricle down here. Then that's gonna pump blood out the coronary or not coronary, the pulmonary artery, which is right here. It does have blue in it, but this is an artery. Okay, then the blood is going to come back in. Oh, you did a great job. You can see all these blood vessels. The blood is going to come back right back in here through the pulmonary vein into the into the left atrium. Then that's going to pump down into the left ventricle, and then the ventricle is going to pump back out blood through where's the aorta? Right there. This big old guy right here. So this is the aorta. Kind of got cut off a bit, but this blood, this hole right here is going to go into the aorta, and then that whoosh, is going to pump blood to the rest of the body. So that's the systemic circuit on the other side. Okay, so if we look right next to it, you can see where that pulmonary artery was going. So the pulmonary artery is going in here and in here, right into these guys right here. So these are the lungs. There's a few different lobes of the lungs. And what I'm going to get you to do is just hold up the lungs, and then can you see across the back there's like this fascia and blood vessels here?
Yeah,
You're just going to go snip, 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 cut that stuff out, and then you're going to flip it over on the other side. Same thing, get behind it and just go snip, 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 and then cut out the lungs. Okay, yeah, hold them up, and then you're exactly, snip that fascia along the back.
How am I
So the lungs are kind of loosely,
How am
well,
I supposed to get in there?
not that way, cutting this way, or you can start at the top and cut down this way.
Wait, this way?
Yep.
Can I try?
There's fascia at the back,
Wait,
it's
right here?
holding it to the back of
Down
your
here?
thoracic
Right
cavity.
down
Yep, you got it, exactly down there.
So the lungs are the same size.
There, what's right?
Are the lungs are the same size?
Approximately.
Oh,
Your
wow.
right lung is a little bit bigger than your left lung because your heart is more on the left side. So you kind of need like a little extra space on the left
Yeah,
side.
probably
So the lung is a
too.
little bit smaller. Yep, just like that. Yeah, you can snip that.
Interesting.
Okay, so there are the lungs. You got it in your hand.
Oh, wow.
Awesome.
That's nice.
So we've got, there we go. Right lung, left lung. It's
Beefy.
pretty beefy, eh? They're pretty big. They are pretty big. Pretty big. If you feel them, they have like this sort of squishy quality to them, and that's because they're filled with those little air sacs, right? They're full of alveoli. So much more than any of the other organs in here, they're quite squishy. It feels kind of like a sponge. They're very spongy, because just like a sponge, they have all those little cavities inside. Anyway, so that's them right there. These have never breathed any air before, so they're pretty compressed. So once they actually do some breathing, I mean, these expand quite a bit. This is like a completely collapsed lung because it's never had air in it before. But so it's pretty much as small as it's ever going to get.
Wait, so is that the spine? Like that big vein thing?
The spine is back. This right here
Yeah, what is
is the inferior vena cava, and
Everything.
the main aorta is behind it, the artery.
So that's called, what did you say? It's called,
Vena cava, inferior vena cava. That's the big vein that goes into the bottom of the heart, right? Coming from the lower half of your body. Behind those blood vessels, so if I were to snip those away, which I can absolutely do,
so what is
the spine is behind that. So if I so if I move this blood vessel out of the way, you can actually see it. There it is right there. Bump, 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 bump. A little bit of, sorry, there's a little bit of goo in here, but you can definitely see the bones. This is like bone, 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 bone. So the spine is behind there. And you'll notice, by the way, that these main blood vessels, the high-powered aorta and stuff, it's pretty much as deep in your body as it can possibly be. And that's for a reason, right? It's most protected when it's deep in your body. You don't want your highest pressure vessel in your entire body being close to the surface. Otherwise, you'd be easily killed then if it was ruptured or damaged. Okay, so the last thing I want to show you here is the upper part of this system. So we looked at the heart here and some of the main blood vessels.
so underneath down there?
I wanted to show you the trachea. So the trachea, I'm going to have to trim some of this stuff off here so you can see this a bit better. But the trachea goes down into the lungs, right? Sorry, I'll try and keep my hands out of the way while I'm cutting here. I'm just removing some fascia and some blood vessels and stuff that you don't really need to see.
Why is there a lot of fascia in this pig? Is there supposed to be a lot of that?
Absolutely, it's holding everything together, right? Like there's a bunch of connective tissue in there. Your organs are not just like flopping around inside of your body. They're all like attached to the thoracic cavity or attached to the abdominal cavity. So they have fairly strong attachments. They're not really floating around. Okay, here we go.
What is that now?
What I'm removing right here? So this is
Thing you're holding
the
with the pinky.
superior vena cava that I'm removing, and attached to the back of it, this second vessel, that's the aorta.
Wait, can I see that?
They're big. They're pretty big blood vessels, eh? Like that's a
It's a blood vessel?
yeah. So this is the main artery basically of the body. This comes off of the heart.
What's underneath this?
Underneath what?
This part.
Underneath the kidneys, the back of the abdominal cavity. Your back. The kidneys are all the way at the back. They're the furthest back in your abdominal cavity. So once you go below that, there's nothing. Your back is below that. So this right here, this tube, it's kind of attached to the artery here. So I'll just snip it away from the artery and the vein. So this is your trachea. So that's the trachea. If you look really carefully at it, you can actually see that it's ribbed. So it has these little ribs going up and down. We talked about that when we talked about the respiratory system. It holds it open. So even if I let this kind of droop, most of the blood vessels and stuff will collapse. But this thing will always stay open because it has these little ribs across the sides. I can even, if I run my scissors on, I can actually feel them. It's like do 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 do. You can like feel it running over. It's like a washboard feel on the surface of it. Okay, and just to prove it, if I take my probe and I put it in the pig's mouth here, and I stay at the front. So remember, we've got the epiglottis right here that's going to cover up the trachea, right? If I put this down the front tube, so now I've got it underneath the epiglottis and into the trachea, I can push it. Oh, sorry, I came out the side. I think I broke a hole in it. Oh, no, I broke a hole in it. Oh, maybe I threaded it. Let's see. I think my probe is just a little bit too sharp at the end, and I think it poked a hole in the trachea. I'm getting it in there, guys. It's happening. Come on, get it in the trachea. There you go. Well, you can see it. There's the probe inside it right there. Can you guys see that? I can't really. Can you see the probe right there? It's the odd shape. It's this thing. Okay. I can't push it all the way through without breaking it, but that is the trachea. So it's connected at the top, right underneath the epiglottis. Okay, so the epiglottis covers that. If I were to push it now behind the trachea, now it's just going to come out down here. And we already cut this part off, but what would this tube be back here? Where this is coming out. I already cut it off, but the esophagus. Okay, so back here is the esophagus, and that would have connected down to the stomach. We already snipped it off because it was in the way. Okay, so there you go. We did a review here of respiratory system, circulatory system. We talked about the heart, and we went through and did the digestive system. Question?
Why the tongue is so long?
Why is the tongue so long?
I don't understand.
I don't know. It's very effective at moving food around in the mouth. I don't know. Omnivores tend to have really robust chomping mechanisms because they're eating meat, so they got to be able to tear stuff apart for meat eating, and they also have to have really strong jaw muscles for breaking down plant matter. So omnivores usually have really robust mechanisms in their mouth. Whereas if you're purely a meat eater, you really only just need to be able to tear meat, and then you let your digestive system do the rest. And if you're a plant eater, you just need good grinders in the mouth. But omnivores kind of need a little bit of both. Yes?
Are the eyes still in?
Yes?
Can you see them?
For sure. You guys want to do an eye dissection too?
Yeah.
Sure.
We can do that. We have time. Okay? Let's have a look at these eyes. I'll try and move this so you guys can see this a little bit better. I'm going to sit down for this one. Some delicate cutting here.
I can really smell this on back here.
Sorry, yeah, it's a little bit gross. The pig's been out for a while, so. All right, there's an eye right here. If, by the way, people at home, I'm fully aware that people have eye things where they don't want to see eyes. Totally cool. Don't look at it then if you're not into this. No big deal at all. But if you're interested in the anatomy of the eye, it's pretty cool. What's that?
You can actually cut the eye.
Yeah, I gotta take it out. How are we gonna look at it without cutting it?
What about you cut the head off and then just
Why would you cut the head off? That's
Just take
insane.
the
I think that
body, put
actually
it on
might make
this
it more difficult to dissect the eye if I did that. But so I'm gonna remove these.
eyelashes?
Yeah. My partner is a physician, and once a month, she does surgery in London, the hospital. A lot of it's plastic surgery, and I cannot imagine doing this on a human. It boggles the mind. Like I realize obviously people do that, like that's a, but man, would I ever not want to do this on a person? Holy cow!
Oh my god. Oh, so you are a physician?
Yes,
Doctor.
she's a family physician, but she does
This reminds
do
me
a
of
little bit of
horror.
surgery every month as well.
Eyes
What's that?
This reminds me of like a scene from a horror movie where this person basically cuts off.
I know it's Halloween, but let's not try and dig into that too much. So what we're seeing right here, this is the cornea, and then you can see the pupil here. Well, this is the iris actually. I'm not sure we can actually see the pupil. We'll when I take it out, we'll see what we can actually see. But I'm gonna try and get behind the eye without damaging it, but it's a little bit tough. I don't want to pop it. Actually, I'd like to remove it first. So the problem is it's held in by a bunch of muscle all around. Those are your muscles that move your eyes around, right? And there's also a fairly beefy nerve at the back. That's the ocular nerve that transmits the signals from your retina at the back of your eye to your brain. And it's quite a beefy nerve. So I want to cut that, but I also don't want to damage the eye. So I kind of got to get behind it. Apologies. I know this is probably like the least easy to look at, especially if you're squeamish.
Interesting.
My apologies, people at home. I kind of fell off track of reading the comments here. Let's see. Oh man, Jaden, please tell me this didn't make you hungry.
Wait, what?
What?
I think I answered all the questions that are in there already. I think. Did I? Oh. I kind of figured.
Mr. Beagle.
Yes.
You know those people that dress up dead people for funerals?
Yes.
I can't imagine doing that.
Really? Well, that's interesting. I'm less squeamish about that, for some reason.
No, that's wait.
Like I feel uncomfortable touching a dead body.
Interesting. That doesn't bother me quite as much. I should say that if I knew the person, I'd probably feel quite different, but it doesn't bother me quite as much. In that case, I feel like you're just sort of paying respect to a person. It's different than cutting them open. Like that's.
Yeah.
Okay, here we go. Eyeball.
Oh my god.
It's squishy.
Yeah, it's definitely squishy.
Oh my god.
Okay, so I'll try and clean this up just a bit so you guys can see the tissue on the outside of this eyeball. I want you to be able to see the nerve. Oh, I cut into it just a touch. Sorry. But you can perfectly see the ocular nerve coming out the back of this, which is what I want people to see. Okay, I'm actually going to try and put this, oh, I got a bunch of gross stuff on my fingers. How do I move this? What's that? Oh yeah, absolutely. Yep. Okay, I'm going to try and use this magnifying glass. We'll see how this works.
Oh
So I'm gonna bring the eyeball right up to it. We'll see if we can.
Oh, Jesus.
Okay, so that's the cornea across the front of the eye. And what you're seeing underneath the sort of darker region is the iris, and right in the middle is a little area where light is actually going right through. It's slightly lighter in the middle. I don't know if you can see that. That's the pupil right in the middle. At the back, if I flip this over, you can see that there is like there's like a little cord up here coming out of the back of the eyeball right there. And that little cord right there is the optic nerve. So there's no way for me to get it out without cutting it, but you can kind of see if I turn the eye sideways that there's like a little cord coming out the back, and that's your optic nerve. So that's transmitting information from your retina at the back of your eye into your brain. So what I'm going to do now is I'm going to cut this eyeball open from the side so that you can see what the eyeball looks like inside.
That's crazy. Oh my gosh. Ew. Why is it so black inside?
All right, so this right here, what you're looking at is the back of the eye. I did damage it a little bit, but it has like this, I don't know if you can see this, it's like a almost clear skin-like coating across the back. That's the retina. So that's all nerve tissue across the back that is light sensitive. So it's all across the back of the eye. It's a little bit thicker in the center, and this is what is actually picking up the signal when you're looking at things. This is like seeing light at the back of the eye. On the front of the eye, it's a little bit more interesting because that up here, right in the middle. There we go.
Oh my god.
Right in the middle. Probe up here. This thing, right in the middle of the thing, this is the lens for the eye. So normally, this lens right here, which is fairly soft, because remember you can change the shape of it so you can focus on different things, focus close, focus far away. Normally it's totally clear, right? So the reason why this one is all cloudy and looks like white and pinkish is because it's just been a preservative. But if you get a fresh eyeball, if you ever have a chance to open a fresh eyeball, this is actually crystal clear, this part in the center. It's really cool. And you could take it out, set it down on a newspaper or something like that, and it will magnify the stuff underneath it. It acts just like a magnifying glass, which is really cool. Yeah, it's unfortunate that I can't do it with the fetal pig, but the preservative really makes it go cloudy, so there's no way to do it. But if you ever have a fresh eyeball, we used to do cow eye dissection with fresh cow eyes. And if you can do that one, then you can just take the lens out and use it. It is a lens, like it works like a lens. So that's really cool. Yes.
So can you basically plasticize the eyes and basically use it as a magnifying glass then?
I don't know. That's an interesting idea.
Or at least take that what is that called? Like it's very clear that you just touched. What is that called?
The liquid, or the lens itself.
The lens.
The lens.
It's just called the lens.
Yeah, it's the lens. It's the lens of the eye.
So
Yep.
can you like cut that out and use it as a pigment?
You can. I mean, it's again, it's soft and organic, so it's gonna like start rotting pretty quickly.
So
But if it didn't, absolutely, it is just a functional lens that you can use, which is kind of cool.
That is really cool.
Yeah. Did you in optics last year? Did you guys not do? You didn't do eye dissection?
We learned about it, but we're just
I'm just curious.
it's like when you look at the picture, inside your eye is actually.
So you've seen that. You've seen that. Yeah. So that's what the lens does. It's creating an image on the other side of the eye, which I was just holding here on the retina. So it creates an image on this. It was almost like this was like a movie screen or something like that. And then the cells on here are going to turn that into a signal that your brain can see, like actually see.
It's pretty cool how they put the picture for you so you can see everything.
That your brain does that.
Yeah.
Yeah, that is cool, isn't it? It like inverts it back again for you. Yeah, that's so cool. Okay, guys, I don't have any more there. That really is the field picture dissection. So I have done the brain before, but I'll tell you what happens almost every single time we do it. it's extremely difficult to cut the skull open of this thing. And by the time we get it off, which takes half an hour, you usually mash up the brain so much that it just looks like a piece of pudding. So you spend a lot of time opening it up, and at the end, it's just nothing. Like there's nothing to see when you open it. So I don't really do the brain anymore. Honestly, it's not worth it. I've done it so many times, and once you get it open, it's just a pudding, and then people are like, oh, well, why did we spend half an hour finding that pudding? It is, the skull, I realize this is a fetal pig, but the skull on a fetal pig is still, it's pretty thick. Like this really takes some cutting. So if I had maybe like a light bone saw or something like that, if I could really get into it better, it probably would be easier. But I don't have the right tools to get into the brain, so I'm not gonna do it. Is there anything else people would like to see? Oh, that's cool, Micah. And anything else people were interested in poking around with here before we put them away?
I didn't develop yet, or
Yep, they're in there. I had to be a little bit careful. You can actually see them. They're in there. The incisors right here are the ones that you really feel. They're quite sharp, actually. I have had people cut themselves open. Can you see them underneath there? There's definitely teeth.
oh yeah.
So they're not like human babies, where mostly they come out with no teeth, but pigs are pretty much good to go when they come out. They get out of there, they spend a couple days sort of adjusting to the world, and then they're pigs. They're ready to get moving. Humans are really unique in that regard, in that when we're born, we are almost completely helpless for years. A really, really long time. In the animal kingdom, that is unheard of. So most animals, when they're born, they require nursing for a very short period of time before they're just kind of capable on their own. But humans have a very, very long care period after they're born.
I think a cow is like 2 weeks.
Yeah.
Or and then they can just
But they're walking right away.
yeah.
You're right, they need to be nursed for a little bit before they get their digestive systems ready to eat grass and stuff, but they can just walk when they come out. Humans are just like, bleh, when they come out, they have nothing. They have no motor control, they don't recognize their surroundings, they can't focus on things. I mean, they're essentially like completely inert, basically, when they come out. They can cry and poop, and that's pretty much it. So, like, compared to other animals, like, that's ridiculous. Like, that's a very weak birth for humans. And the reasoning behind that is actually really interesting from an evolutionary perspective, which is that in order for humans to develop, the number one organ that has to get larger in order for them to become self-sufficient is their brain, right? And you can't have babies with larger brains. Why? What do you think?
Because when they come out, it will. Because the baby has to be very small for them to get out.
Exactly. It's a hip limitation, right? The hole in the hip is only big enough to allow a brain of a certain size to pass through. So it is like a solid, hard limitation on babies. Their brains cannot be bigger than a certain amount, or they just simply cannot exit the human body. So there really is a hard cap on that. So we've developed a very unique system as humans in which we basically birth babies before they're ready to be in the world, and then we just very carefully take care of them until they are ready to be out in the world, which is a really interesting strategy. So not a lot of animals have a strategy like that. Most of them, when their babies come out, can run from a predator almost right away once they're out of the body. But humans are useless for a long time after they come out because we got to grow that brain. Okay, guys, so I'm gonna wrap that up right here. I do have to clean this up, which takes a little while. So for the people at home, this is a really good time for you guys to start working on your medical technology project. Same thing for you guys while I'm cleaning up here. So crack open those Chromebooks. If you haven't picked a topic already, this would be a good time to do it. If you guys have questions at home on, is this a good topic? I'm looking for a topic and I can't find one. I'm looking for sources for research on my topic. Tell me, okay? I'm happy to give you topics. I'm happy to, or help you find a topic anyway. I'm happy to help you find information on your topic. I'm happy to let you know if you have all the things that are necessary for your project to be complete. Just let me know, okay, guys? I want to help you. I want everybody to be successful here, so just let me know. And in the meantime, I'm going to clean this up, so. Oh, gross. So this afternoon, you have a couple options open to you. Let me just show you what's on the content page here. So first of all, you can use your time to work on your medical technology presentation assignment. So I can't remember what I put as the due date for that, but I should put it at the end of Monday, that's not what I have. I have the end of today, but I'll put it as the end of Monday as a reasonable deadline for completion. If you need any help, again, choosing a topic, figuring out sources of information, really anything with your project. You're not sure if you've included what you need to include in the slideshow, just let me know, and I'm happy to look at it. I'm happy to help you find some sources and I'm happy to help you choose a topic. Really, anything you need. Okay, question.
Yeah, I just tried to put it on admin today.
It's on what, sorry?
It's like today.
It is, yeah. I gotta switch it. I'm looking at it right now. Yeah. Oh, is it not showing up there? Should be showing up there. Oh, it's on like a crazy delay. Okay. Give me 1 sec. Let me fix this. Every once in a while it does that. Just starts getting this crazy delay. There we go. Much better. Yeah, I will fix the due date for that. The other thing that you could be working on right now is the quiz for this unit. So the quiz for this unit is, if you go to more, assessment, oops, not grades, not that one, assessment, quizzes. It's also linked on the content page. It says like complete this quiz, and there you'll see anatomy of mammals unit quiz. It's 31 questions. It's mostly multiple choice and a couple true and false. There is no time limit of any kind, and it is open book. So take your time when you write it. Review your answers. Look stuff up, guys. Use every resource available to you. You can really do whatever you need to here. This is meant to be more of an assignment than it is a quiz, because it's open book, right, and no time limit. So you can really take your time on this and look stuff up, okay? What I care about is, can you demonstrate an understanding of this stuff, the stuff about the 3 systems? Not do you necessarily have it memorized. I'm looking for, can you demonstrate an understanding of those systems, okay? So you can think of it like an assignment if you want, but you can take as much time as you'd like, use whatever resources, okay? Totally up to you. Ideally, you'd want to try and complete this during learning block 3 today, or at least today at some point. I wouldn't put this one off. Keep in mind that next week we have 5 days, and at the end of those 5 days, this course is done. We are done, okay? So you're not going to want to stack stuff up. We do technically have 2 more units. I'm kind of stuck a little bit there for time-wise. I think our microbiology unit's going to end up being 1 day long, so I had to compress stuff a little bit in order to fit stuff in. It's a weird timeline, but and we won't do a quiz for the last unit either. We might do like a really short lab activity or something for microbiology, but I don't think we're going to do a big summative project like we're going to do for plants, because we just don't have the time anymore. So, but that being said, don't let this stack, okay? So I would try and get this out of the way. Don't let it go past the weekend, or you're going to get yourself into trouble. Like, you won't want to let these stack. So anyway, that's all I have to say about that. The last thing I want to mention here, so again, you could be working on your medical technology assignment. You could be working on this quiz. Some of you still owe me assignments. Several of you still owe me assignments. If that's the case, please complete them and hand them in. And we're starting to get into a dangerous zone here. By the end of next week, there's more stuff coming, right, that we got to complete. And then there's 2 more days where you'll be in your other class, and then that's it, right? We're going to have those 3 summative days. Many of you are going to need those in order to finish projects that you need to complete. And then that's it, guys. Like, I got to write your report cards and we're out of here. Question?
Also, the vocabulary list.
This what, sorry?
The vocabulary list.
Oh, right, and the vocabulary list. Now, I'm assuming that people are completing the vocabulary list as we go. That's the idea, right? Is that you're completing it just every day as we go? So you just need to turn it in today. Yeah, so you need to attach it to your assignment. Thank you for reminding me, by the way. You need to attach that to the vocabulary list assignment and just turn it in. So that's not a huge big deal, because I'm assuming people are probably already done that. It just needs to get attached and submitted, but where is it here? Yeah, it'd be anatomy of mammals vocabulary list. You click on it, you attach your Google Doc or whatever file where you've kept your vocabulary list and submit. Yes?
I just have a question about the 1 video that you sent.
Sure. Can I go through the process of setting a video first? So I will absolutely answer that question as well. So real quick before I send you guys off to work on this stuff, I just wanted to go through the process of how to cite a video, because I mean, several people have asked me about this already, and you absolutely can use a YouTube video as a source of information. It's obviously not the most reliable source of information, but it is a source, okay? You could potentially use it as a source. I don't know if I'd use it for a, university paper that you're gonna hand it to your prof. But for this project, I mean, it's totally valid to use that as, maybe you're watching one that's an explanation of how CT works or whatever, that's totally valid. So let's say that you do have a video like that. So let's pull one up. Oops, YouTube. Is it gonna open the app? Yep. Oh, there's my live stream. Okay, so let's say that you have this video on, my son's using this account clearly. There's lots of little kid content on here. Sesame Street, that's cute. He must have borrowed my iPad. Okay, let's say that you're watching this chubby emu video. Okay. Skip. All right, and you want to cite this, okay? We're gonna go through the process. So I'm gonna quickly look up here, APA citation. And there is a really good website called, so Citation Machine used to be excellent, but now I think it's a paid service. So I think you have to pay for it in order to use it now. You don't? You just need to sign up for it?
No, they say if you put like a link there and then you want to do another one, it's like a video you can watch.
Then you have to sign up.
Go around for 48 hours to get all the source that you need.
Okay. So you mean you could go through that? Sorry, just one sec, guys. The phone's ringing.
Oh, stop ringing. That's just a matter of me, I guess.
That was weird. Still working? Yeah. Okay, so you can also use, there's a bunch of different ones here. BibMe. This one's called BibMe. Yeah, so this is it's bibme.org. Bibme.org. It's bibliography. Bib is short for bibliography. So you can select APA, and you can try. You could try just putting the website in and having it search for you, but so you could try it this way. Let me try it first, just with the URL. So let me grab the URL out of here. Share, copy link. This might work. It's doing a lot of loading. Loading. I can't tell if it's doing something or it's just saying loading.
Still loading.
Still loading. Okay, so if this doesn't work, which it looks like it isn't going to work. Oh, did it go? No, didn't. You can do manual entry mode. Okay, so I think this is probably what you're going to have to end up doing. And then you basically just fill this stuff in, everything that you know, okay? If you don't know something, you leave it blank. That's all you can do, right? So sometimes there are missing pieces from APA citations when you just simply don't have that information about the thing that you're citing. But I mean, ideally, you'd have some of this. So the film title would be taken straight from the YouTube video. So this one is called "A Dad Mistakenly Drank a Lava Lamp at Bedtime, and This is What Happened to His Kidneys." Is it going to let me highlight that? Oh, do I have to type it out? I really don't want to do that. This app is really acting up on me. It is going to make me type it. Okay. So you would type the title in, Dad mistakenly drank, okay, etc. I'm not going to type the whole thing in. And then in terms of contributors, you just give whoever you have as the contributor here. So this guy is a doctor. And he would be really all of these things. the performer, the director, producer. He's all of them. So I mean, you can list him as just one of them. And I'm not sure if his actual name is here.
Wait, so did you click video when you did it, or did you
Video, yeah, I clicked on video. Yep. Now these videos in particular are really good because they have their own references at the bottom where he got all of his information from. But what is this gentleman's name?
did it say,
I might have to go to his YouTube page to figure that out.
did it say underwrite or the subscriber's name?
Where would it be?
It could say either where it says publisher, which is under the video, or it could say it as some people use their actual name as.
Yeah, but I don't think his name is Chubby Emu.
No, it's under, if you click that, when it says like the date it will tell you the publisher usually.
It doesn't have his name on there, I don't think. I was just looking through that information. So this guy is a doctor. What is his name? You don't necessarily have to have the name of a person, but if you can find the name of the person, I would. Wow, I'm actually shocked that he doesn't have his real name on here. That's by Chubby Emu. Really? Interesting.
And that's a real name.
I guess he doesn't want people contacting him in real life. So he doesn't include his real name. So this is a little bit more difficult because it doesn't have a specific name for him. But that being said, you can do something else. So it does have the producer listed for the video. So going back to that video, right here, it actually says right underneath here, production. Let's see. Physician, nurse. Production assistant is the only person. So it doesn't actually have a listing here for production assistant. A PA would be, it's none of these things. I'm gonna have to list them as producer. That's the closest thing I've got. The producer for this, or the production assistant, is Bradley Williams. Okay, close enough. Bradley. Last name Williams. Okay, and then the website. So here you would just put in the URL for the video. Then it says electronically published. That's the day the video was published. So published on May 6th, 2019. This is the 6th of May, 2019. And then you put in the day you accessed it. So that would be today. So this is October 30th, 2020. Okay, and then create citation. And there it is, right there. So then you just copy and paste that and you put that into your APA citations. Question?
Yeah, when I do that, it doesn't show me the whole stuff. It just says loading.
So did you click manual entry?
Okay. No, I didn't.
Try that. Try click manual entry, and then actually you got to put in the information yourself. So it looks like for YouTube specifically, this program is not able to like pull all this stuff out of a YouTube video, so you just have to enter it manually. But I think if you do that and then you click, you know, the go button, then it should work. Okay, so this is what you're going to use for your APA citation. Guys, let me know if you need anything. When you're writing the quiz, if you don't understand a question or something like that, just let me know. Okay, I'm going to keep my email open. I'll keep this chat open. Chat is probably the easiest because it's in the corner no matter what I'm doing here. So let me know if you guys need anything at all while you're working. Okay? All right, let's see how much we can get done here in the next hour and a bit.